Everybody, and welcome to our webinar, which is titled An Introduction to Co-Production. Just some very quick housekeeping reminders to run through. Our presentation is scheduled to run until 12 o'clock. The session has been recorded, so please do remember to keep your microphone on mute so we don't pick up any background noise. And we have time dedicated to questions at the end of the session. So if you're making a comment or asking a question, please either pop up your hand or put something in the chat. The slides from today will be emailed out after the presentation, along with the recording and an evaluation form. And please do take a couple of minutes to fill that form in. It provides really valuable feedback to us. During the webinar, if you need to access closed captions, please click More on your Teams toolbar, then Language and Speech, then CC Live Captions, and we'll also put that into the chat. For anybody who's watching this recording back, if you want to offer any thoughts, there'll be a QR code at the end of the presentation, and that will take you into the evaluation form. So please do add your comments to that. So on to our presenters. Our team of presenters today are really keen to share their experiences and examples of working with and being public and community contributors. Now, in the interest of time, I'm keeping the introductions really brief, but needless to say, I'm delighted to welcome all four speakers, and I know that we'll all learn a lot from their expertise. So starting with HDRC Bradford's contingent, we've got Shabana Din, and she is HDRC Bradford's co-production and partnerships lead. And we also have Zahid Hussain, who is a public contributor and has supported the creation of the Bradford HDRC Community Areas Research Interest, Community Areas of Research Interest. In 2025, Zahid also joined the Specialist Centres Research Zahid also joined the Specialist Centres Public and Community Partnership Advisory Board. He has a passion for research inclusion and is a leader of the Rohingya Association, which is a charity dedicated to finding sustainable solutions for the Rohingya people. We also have Anna Price, who is an Associate Professor in Primary Care and Children and Young People's Mental Health. She's based at our Exeter University satellite, and will be talking about some of her work co-producing research with children and young people. And we also have Sian DeBell, who's a research fellow and methodologist, also from our Exeter satellite. And Sian will be talking about co-produced citizen science project, which focused on air quality. So Sian, I'll now hand over to you.
Great, thank you, Nicola. So I'm going to be talking about an example of air quality citizen science, as Nicola said, but I'm also going to be talking about the definition of co-production and some principles to think about when doing co-produced research. So I guess co-production is kind of used in a range of areas and has come from a range of disciplines. So it's one of those slightly confusing things where it doesn't have even a single name. So you might hear it referred to as kind of co-creation or co-development, as well as co-production or even participatory research. And there are also things like citizen science and PPIE, which, depending on how you do them, can be co-produced. But I think the really key thing to remember is that co-production is all about doing research with people rather than to people, so involving people in that process. And looking at NIHR's definition, that goes into a little bit more detail about that. So co-production is an approach in which researchers, practitioners, and members of the public are working together from the start to the end of a research project. And they also mentioned this definition about sharing power and responsibility and the generation of knowledge, which I'll talk about on the next slide, and kind of these principles of co-production. But just to think about PPIE as an example of something that can and can't be, or can and isn't always co-produced. So this is again another definition here, but PPIE is similarly to co-production about doing research with members of the public rather than to them. And if, for example, you were involving a public contributor who was part of the research team, and they kind of joined at the start of the project, helping develop the research questions, being involved in that research process, and then also at the end of the project kind of helping with dissemination of findings, and sharing in all the kind of decision making that goes on through that research project. That would be an example of a co-produced approach to PPIE. But you're probably also familiar with having a group of public representatives who are at various stages in the project you might hold meetings with them, maybe to discuss the focus or to develop your participant-facing materials. And that is an example of something that's more kind of advisory or collaborative, where, it's an important approach, and depending on the research project, is the right kind of way to approach things. But there isn't that same sort of sharing of power, so it's probably the researchers who are going to have the kind of overall decision-making responsibility. So moving on to kind of think about some principles to make sure that when you're doing a co-produced research project, it is sort of genuinely co-produced. So NIHR and various other organisations, I think local, at personal, and I think we'll share slides and things afterwards, so you'll have some sort of links to resources. But they've come up with a range of principles to think about when co-producing research. So firstly, there's equality. Researchers will be bringing experience of research methods, members of the public, their lived experience of the kind of issue that is being researched. And within co-produced research, both of those are equally valuable and important. And linked to that, you need to have sharing of power. So people have different experiences, but decisions still need to be kind of discussed and made equally. And in order to do that, you need to kind of build and maintain relationships among that research team. So that kind of communication element is a really key part of co-production. And then there's accessibility and diversity. So accessibility is, the things that you'd already be thinking about in terms of say meeting times or venues that work for everyone, making sure that the materials that you produce are in different formats, suitable formats. But also thinking back to the kind of different experiences that people might have. I think that training and support are a really key part of enabling accessible co-produced research. So, for example, public contributors might want to attend some training about the research methods that are being used, and you might want to build in things like meetings at the beginning where you're discussing the kind of lived experiences of public contributors to gain understanding of the topic. And then there's diversity. So I think one of the points of doing co-production is that you are seeking those voices that you might not always hear in a research project. So it's important to think about, say, the process of recruitment, making sure that you are kind of involving those range of views, and also providing the support so that people can stay involved throughout a project. And then just a final principle, so reciprocity. So making sure that there is clear communication and expectations are set out. So that's both from thinking about the researchers, why you're wanting to do co-produced research and what you're hoping public contributors can bring to the project, but also discussing with your public contributors, is this about making a difference, about learning about research, what are they hoping to gain here, and recognition of everyone's contributions through things like co-authorship, but also if researchers and practitioners who are involved are being paid, then it's important for public contributors to be paid too. So NIHR have guidelines on this and kind of appropriate contribution for different elements of a project. So just to talk about quickly through a brief example of some research that I've done. So this was all about air quality, and it kind of started out from a feasibility study where we asked people to carry around individual air quality monitors, and so we could kind of see the experience of the air quality that they were experiencing as they went about their day-to-day lives. And in the conversations that we had after that, I think it was quite evident to us as researchers that perhaps the questions that we thought were most interesting were not what people who were carrying these monitors around were most interested in. And we thought it was important, as they were the ones carrying the monitors, that we should be addressing those questions. So we got some funding to do some agenda setting. So we held 2 workshops with the communities we've been working with, one in Caerphilly in South Wales and one in Camborne and Redruth in Cornwall. And kind of thinking through the principles of co-production, we we spent time mapping out before inviting people to these workshops, mapping out the different kind of community organisations in both areas, so that we could make sure that we were representing, the range of people who were there, and we made sure that we built in funding for people's time for attending, and so that we could have an accessible venue and kind of think about the resources that we were taking to the workshops. And within the workshops themselves, we kind of spent quite a lot of time kind of making sure that people knew each other and felt comfortable sharing information, and also in kind of having explanations around air quality and what could be measured, what different kind of monitors are that could be used, that sort of thing. And I'd say that the one thing that we perhaps didn't do as well within these workshops was we wanted to keep it really open, just hear anything that people were interested in measuring around air quality. But we potentially left it a bit too open. We didn't bring our expertise as researchers. So some of the suggestions were kind of, not really feasible for this kind of research project. So things like changing active travel infrastructure, when really if you're just carrying around a monitor, it's more, you're seeing what's there and maybe getting some data that you could take to the council or something to try and make a change. So that was a bit of a learning experience, and it's kind of meant that actually landing on our specific research idea has taken a bit more time, because we've had to go back and forth, not just within the workshops, but kind of afterwards through emails and additional meetings. But we now have schools that we're working with in both areas, as that was kind of what people were most interested in, was changing air quality around schools to make sure that children at playtime and when they were being dropped off, seeing what that was like and whether it could be improved. And we're getting some funding for that at the moment. So thinking about some, just moving on quickly to frameworks and ways of working, so thinking about some of the practicalities which are kind of brought out in the principles, but there are various frameworks for doing co-produced research that kind of think about these principles, like the UK standards for public involvement, where inclusive opportunities is something that kind of fits in, but then the frameworks also tend to bring in some of those more practical elements, so things like the support and learning needs and governance. So I've just on this slide set out a kind of process for it. If you were doing a co-produced research project, you want to be recruiting your public contributors and setting out roles and responsibilities, and then they'd be involved throughout the research process. And that would be something that you'd be thinking about as a researcher, sort of making that happen. But also at the organisational level, you might need to think about the kind of structures that you have in place. So whether people who are being involved in this research project need some sort of role description, whether you have the kind of processes in place to enable compensation for their time, and also what that means in, I don't know, in co-authorship of kind of reports and things, whether that would need to be approved and at an organisational level. So just kind of, there are practical things to think about as well as doing the actual research. And then just to finish up before handing over for an example, I guess the kind of why do co-produce research? So I think there are this kind of fits into two main areas. The first is by working with people with lived experience of an area, you're hopefully making sure that the research is really relevant to them and to what they're experiencing, and so it's reducing research waste and creating knowledge that can be used to generate change, to kind of improve public health. And then the second reason is around the kind of research process, so improving the research process, making sure all those issues around ethics and equity and the reasons that people might want or not want to get involved, hopefully you're able to improve that through bringing in, again, the kind of experiences of someone who might be involved in research from the other side. I'll pass over to Anna now to talk through an example of this.
Great, thanks so much, Sean, and thanks so much for outlining the principles and the frameworks, which I think are absolutely key for understanding where we're aiming to come from and then thinking about how we can practically make it work. And you'll see from all our examples how much variety there is. I'm just going to share an example of how my research, my programme of research really has progressed from patient and public involvement, PPIE, through to full co-production. So this is around work that I've been involved in for over 10 years around improving access to healthcare for young people with ADHD. And the collaboration has been there from the start. So the first project I was involved in 2016 to 19, through which I completed my PhD as part of a job role. It was an NIHR funded study. And this study revealed gaps in ADHD provision for young adults in secondary care services. And we had lived experience advisors throughout that study. And coming towards the end of the research, it was a lot of the voices of the people with lived experience that prompted me to go on to the second study that then I led, which was around managing ADHD in primary care. So within that research, and I'll tell you a little bit more about that, I consulted with stakeholders and we were aiming to map current provision in primary care services and find solutions. And I actually built in a specific co-production study to that piece of research. And then that has led so that was 2021 to 23. And now I've just started a larger program of work called Smart ADHD, which is using our learnings to fully co-produce some digital health interventions to try and meet those gaps in provision. So just to tell you a little bit more about the second example on that slide, so the MAP, or Managing Young People with ADHD in Primary Care study, that's not everyone who's in the research project, but that's the majority of the people who were involved in leading the project and delivering on it. And you'll see that we had a research advisor, so Anita Salimi was involved from the very start of that project, and she actually co-led our Young People's Research Advisory Group with me. And I set up the research project, which had 3 work packages with a structure. I'm quite visual, so I find structure quite helpful. So the research was delivered in partnership. We had a couple of charitable partners, UConn and the ADHD Foundation. And then we had these research advisory groups, or RAGs, which met every 6 months. And I felt it was really important to bring in the lived experience, both of people with ADHD, but also of healthcare professionals who are aiming to deliver care within services. So yeah, the groups met every 6 months. And then at the end of the project, we actually had a co-production study where people from those groups and additional representatives of the different perspectives came together to co-produce some guidance. So as I said, the MAP study had 3 kind of key research questions, and the first 2 were delivered with, if you like, research advisors running throughout, but more as traditional research. And then the third study was specifically about us coming together, sharing power, so that when we co-produced our guidance, we included the voices of healthcare professionals and people with lived experience of ADHD in our findings. And what did that look like? So we had already built relationships through the research advisory groups. We also invited a few more additional people with different sort of stakeholder experiences. And we had some workshops. My colleague, Becky, she actually delivered those workshops. She created a workbook where we synthesized the findings from the research to date. And then we had some really lively discussions. People had opportunities to feed in ways that suited them. So by written, completing sections of the workbook, through online sessions in a group or one-to-one if that was more comfortable for them. And then we reviewed the findings and co-produced our guidance and had follow-up meetings. And there were some quite challenging conversations around trying to incorporate the challenges that are experienced, really genuine ones if you have lived experience of ADHD and you're trying to access healthcare, but also the challenges experienced by healthcare professionals in primary care who are trying to support young people with ADHD, but struggling with a system that's not very well set up. And many of those often also had lived experience of ADHD in their families. So if you're interested to see, we've got our co-produced guidance on our website there. And then following the principles of co-production and sharing power and delivery, we were really pleased to have our lived experience and healthcare professional advisors as co-authors on our journal article, and also to come and present our findings with us at a seminar. And that was really important to us, and of course meant that it was, just by definition, what we were doing is much more relevant. So I just wanted to share a little video of one of our PPIE collaborators, Tash. So Tash was involved from the beginning of the MAP study with us, and she's now really immersed in our Smart ADHD research as well. And that relationship has built and grown as we've moved through into full co-production. In this video, this is actually an NIHR film. It's a clip from it talking about PPIE, and she's talking about her engagement on the MAP study. So a little bit of input from Tash there, and she's also recorded some other videos and resources for us on our website. We've got a YouTube channel for SAND, and yeah, it's been brilliant working with her. And she actually, the logo for Smart ADHD there, she actually came up with the initial design for that logo, and then we worked together to create the identity of the Smart ADHD project. So that was the MAP study. Smart ADHD actually doesn't have co-production at the end because it's appropriate for what we're doing. We're co-developing interventions, so we have co-production throughout. We've not only got research advisory groups, including digital health expert research advisory group, because that's a whole new area coming in, but we've also got working groups that we're delivering flexibly to allow people with ADHD to contribute creatively at a time that suits them, because we're trying to work to make sure that we address any barriers to involvement in the research. So those are, I mean, I'm so proud of being and honoured to have been part of the research with all these young people and people with lived experience and healthcare professionals. So I've probably given you the flavour of that, but there are huge challenges involved in getting co-production right. I know I've not got it right many times, and I'll carry on with that, but it's about continual learning, and it's about trying to set up the systems that support you to be able to deliver that. To think about ensuring that you're inclusive in the way you deliver co-production research, to think ahead around any ethical issues or unintended negative consequences. And just to be clear, it is time intensive to deliver co-production research for researchers and public collaborators, but NIHR is really good at helping you to build in the resources that you need for that. That's probably enough for me. I'm actually going to hand over for us to have an example from Shabana, who is going to share from a local authority context. Oh, Shabana, you're on mute.
Thank you for mentioning that. I'll start again. Thanks, Anna. Hi, everybody. So I'm Shabana Dean, and I'm the co-production and partnerships lead for Bradford HDRC. And for those of you who don't know what the HDRCs are, they are NIHR-funded teams called Health Determinants Research Collaborations. And our purpose really is to sort of support local authorities to use research and evidence in its decision making. So when I was asked to sort of support this webinar, I was asked to think of, to give a co-production example. And there's lots of co-production work that we're doing as a Bradford HDRC, some of it that I have shared before on these platforms. But I was asked to share something that I was particularly quite proud of. I guess we've done lots of work similar to some of the examples in terms of priority setting. We have a youth ambassadors program and similar approaches to what we've heard today. But I guess for me, the piece of work that I was most proud of was really a simple but effective one, which was introducing the public contributor model within the council system, which helped us create a sustainable way for meaningful co-production. Now, this was a really simple example, but sort of just go back to the beginning when I started my role in Bradford HDRC. Like many health determinants research collaboration teams, we sort of asked ourselves a question about how we should approach our co-production work. Should we, for example, set up a public advisory group? Should we commission our public involvement or co-production activities out to BCS organisations? So we started sort of looking externally and did some horizon scanning to look at the landscape that we were working within. And many of you will know that Bradford District is a very research active place. We have the Bradford Institute for Health Research, which hosts the well-known BIB, Born in Bradford study. We also have the Age of Wonder study. We have the co-production and peer research network called COPPA. And we also have the ICB research engagement networks, amongst lots of other research activity. We also explored what co-production work was going on internally within the local authority, within the council. And at one of our community of research events, we asked our local authority staff what kind of co-production activities they were involved with. And they told us it was mainly focus groups, surveys, and other engagement types of activities. We then reflected on our role as a HDRC, which was to really build the infrastructure within the local authority for meaningful and sustainable co-production. And I guess for this reason, we made a deliberate decision early on to introduce the public contributor model formally within the council, and we had to start this from scratch. So we did this by working with our council legal and business teams, ensuring that we gave them the rationale behind the role and that we created the necessary infrastructure such as agreement forms, payment processes, etc., to work with residents across the district. As we were externally funded by NIHR, I guess we were in a privileged position to be able to make a really strong case for working in line with NIHR guidance and systems. So in December 2024, we selected our first 2 public contributors to work on our co-production steering group, which then led to some further roles. Of course, this didn't come without its challenges. Sorry, I'm just going to the next slide. We were met with many challenges along the way. It was a fairly time-consuming process because we had to create everything from scratch within a new setting, working within a local authority, a very large local authority. There were lots of long processes for us to get through. We had to consider all the safeguarding things, all the finance implications, data protection impact assessment forms that we had to sort of complete. And there were many a time when I sort of thought, had we, done the right thing, would it have been easier just to commission out some of this work? But I guess every challenge helped us refine the model and strengthen the infrastructure that we were creating. So, a year and a half later, we are reflecting and thinking, actually, those early key decisions to embed the public contributor model was definitely the right one for us to do. Recently, we were approached by the public health team who were creating their infant and early years feeding strategy, and they wanted to co-produce this with residents. They attended one of our webinars and approached us and said, well, actually, we want to co-produce this, but we're not quite sure if we're doing it in quite a co-produced manner. So we spoke to them about the public contributor model, and they were really keen to use the model within their work. So they then had to put a business case forward through to their sort of management teams. And because we already had a working model within the council, they were able to put this through fairly simply. They had some queries, but because we already had the answers to those, we were able to quickly, collaboratively resolve and support them to get the approvals for the role that they needed. We then supported them through the selection process, such as creating the roles, putting call out for potential public contributors, setting up the informal meetings, and we had already created the payment processes that way that they were just able to adopt. As a result, they have selected 3 public contributors that are going to support the creation and delivery of the feeding strategy, working with them for the next 2 years. Following on from this, we were approached by another public health team who were working on a vaping cessation strategy. They were also really impressed with the public contributors' roles, and they sort of described it as a bit of a game changer in their original plans. And they are also going to work with public contributors in the creation and delivery of their strategy. The public health team, the infant and early years team, are actually now supporting the vaping cessation team. So it's kind of less burdensome on us to be able to support that. We've already done it with another team, and that team is now supporting the vaping cessation team to embed that role. Following on from that, we've also been approached from the transport strategy team, who are working on the district's new transport strategy. And again, they want to co-design and co-produce this with local residents, and they are also looking into working with public contributors to develop and create the strategy. So, looking back, we now can really see the impact of those really early decisions. By building the systems internally, we've created a sustainable model that will continue even beyond the HDRC involvement. And I guess the public contributor role is really appealing because it's quite an effective model. It's the public contributors, you know, are not just representing themselves; they're representing community groups and a specific demographic, and they are advocates for groups of people. So sometimes it's more simpler and easier to be able to work with them throughout the length of a programme rather than holding one-off focus groups. We can see now that this model is influencing a culture change and shaping strategies and embedding resident voice throughout the council. So we feel that our early hard work has really come to fruition now, as we can see this model now forms a foundation for long-term co-production within Bradford Council. And I guess it's something that we feel is a real win for us and something that I guess we're really proud of. So I just want to hand over to Zahid Hussain now, who was instrumental in some of our public contributor activity, and he's going to sort of speak to you about some of his experiences. So handing over to you now, Zahid. Thank you.
Thank you, Shabana. Hello, everyone. I'm Jahid. I'm a public contributor for HDSC Bradford. My experience with the HDSC Bradford is like when we formed the group, it's like we had a different group from different area in the HDSC, which is nice. And the things that I have liked mostly is the difference, the experience each group have got to share. When we had few session with the HDSC in Bradford. The things is like each group have got different view with things in common, but in terms of the priority in the research, what we found is for a particular group, that's not priority, and for other group, that's the priority. That shocked me actually in the session, and the involvement as well. The way HDRC in Bradford have involved people from different group is quite different. So we have got a group from different area. And the another things that I like is the been mixed session with BYO and the Rohingya community as well, because this community have quite different view and some background issue as well. But when they came together and they have given a quite different view, and they had to agree into a particular priority, you know, when we have listed things. So my experience as a public contributor, I feel like we can share information that we need to. Sometimes we have something that we want to share, but there is not a place to talk about that. I think this is the best place, like, to contribute what we feel, what we're thinking, and this is also like as a gateway for the community as well. As a community leader, I would say like you know, it creates a gateway for the community to talk about their issue, bringing it into the table, you know, for discussion, which is very good. And this also gives us as a public contributor some kind of idea, learning from here, so that we can take into the community and we can do something ourselves as well. You know, each community, each group have got different issue that they need, you know, to focus on. So this also a kind of a learning place for us. About how things we can get information, how we can collect data as well. We can learn from here, and then we can take some kind of initiative from there as well. Learning, being a public contributor here, it gives me also knowledge as well. So I feel like it make a lot of difference being a public contributor, because the people, each group, have got their own view, have got their own issue. So this is the best place to talk about. While we can't expect any result immediately, but at least this is the place to share information, and at least where we can talk about. And the beauty is the diversity of the voice. Sometimes that I think are quite different from another area, and that the things that's different for another area. Yeah, each time it's the beauty is the diversity of the voice that we can see. And when we have to come, we have to agree for a particular priority listing. That's also another beauty, because somehow we can see the difference, you know, which one is more which one we have to prioritize than other one. Yeah, after I would say being a public contributor is the best place to bring the things what we think internally, and it's like also another beauty is like as a public contributor we can say anything, so it's just anything whatever we feel in our mind. It's just about sharing that information, so either it's right or wrong, no matter, it's just about talking, bringing that feelings into the table there. Yeah, thank you. Now I will hand over to Nicola.
Thank you, Zahid, and thank you, everybody. Brilliant presentations, and great to hear about those experiences and examples of work that's ongoing. Really great to hear about the different people involved in lots of different ways. So happy to open the floor to questions to the panel now. And there's been lots in the chat already, actually. So I think while people are having a minute or two to think about formulating their question, it would be great to dip into the questions in the chat. And actually, there's a number of them that are on a very, very similar theme. So happy for a couple of panel members as well, and Zahid, particularly for you to share your experience of this as well. So to get the expertise and actually, your voice within all of this. First question, if I just go right up to the top of the chat, I guess is a slightly more technical one. It's about terminology. So Shakil has asked, what is the difference between the PAR, participatory action research, and co-production and co-creation? Are these terminologies used interchangeably? Who would like to tackle that one?
I'm happy to give the start of an answer if anyone else wants to chip in. I think so. I guess co-production is a kind of approach rather than a method, whereas I think that participatory action research, that kind of fits into that's a kind of method of doing research. So I guess it's that slightly complicated. Well, co-production kind of overlaps with various things, so that's why you get these kind of different terminologies. And I'd say that, yeah, co-production, co-creation, co-development, they are used pretty interchangeably, and perhaps might, if you were doing something like Anna was talking about, developing an intervention or a toolkit or something like that, you might term it co-development or co-creation, whereas if you were looking at the impact of something that already exists, perhaps that would be a co-produced research project. But I would also say it's probably more important to think about those principles and kind of involving people in the research than get too hung up about the specific terms and yeah.
Yeah, I might chip in here as well. Yeah, I totally agree, and I think I always go back to definitions, which is of course what this question is asking. But if I was thinking about this for myself, I'd just do a quick Google and research it. I've looked a lot at the difference between co-production, co-creation, co-development, and my understanding, and I've just defined terms for what I do because I think everyone understands it slightly differently. But exactly as Sian said, I would see co-production as that set of principles that you can then apply a framework to. Co-creation could be seen as slightly less all-encompassing. Like you might, if I was just doing co-creation, we might just co-create, like the logo I showed you that Tash helped us to make, and she might have co-created that with us. But actually, our whole program of work is co-production. We're co-producing from the beginning. The research question came out of discussions from our previous research advisory groups, and where we go is shaped by it. So for me, co-production is slightly broader, but it might be used differently in the literature, and so you kind of have to look at how someone's using it to understand what they mean.
Thank you both. And Misha, I know you'd asked a question prior to Shakil's question. I wonder if they are connected, because your question in the chat is about a resource talking about multiple frameworks to guide researchers. And again, I wonder if that links in with the terminology and sort of defining almost about, if it's co-production, these are the steps. But if you want to clarify that at all, Misha, if the answer that Sian and Anna has given doesn't quite get there. There we go, hand up. Come on in, Misha.
Thank you. I just wanted to clarify, because I'm trying to design a co-production work stream, and my supervisor's talking about different frameworks that could guide the way I'll be co-producing. They've talked about double diamond, they've talked about all different ways of doing it. And in my view, it's a bit of an abstract for me at the moment because I'm a novice. So I was just hoping if there's like a resource that could summarize different frameworks, that would be much appreciated.
I'll come in, and then Sian, perhaps you could. Well, I mean, obviously, anyone. I don't know, Shabana, whether you've got thoughts on this side of things as well, or Zahid. So I think in terms of co-production, if you look it up under NIHR or any of the other big funders, you've got the kind of outline of the principles framework, but then there's that shift between that and a methodology. So my understanding, when you talked about the double diamond, so that I think that's an approach to understanding a process of intervention development or of refining a concept. So if you look up the UK standards for public involvement, the Involve guidance, that's again all that co-production overarching. With my research, I'm following something called the person-based approach to intervention development, and that is person-centered, so you can use that with a co-production approach. There are also MRC guidelines on developing complex interventions, and I actually don't know if intervention development is what you're thinking around, but so it's like there are frameworks and guidance, but it's whether you're looking for a specific methodology where you have steps that you follow, and you could follow lots of different methodologies, but it's understanding the principles of your approach, which would be the co-production. Maybe another panel member could come in and provide a balance to my viewpoint.
I think I would really agree with what you've said there, Anna. You've kind of got the separation between the co-production bit and the framework that you might be using. Unfortunately, I don't know anything that brings together all of the kind of like different co-production kind of guidelines and frameworks and things like that. I mean, we'll share slides and resources and things which will hopefully give you some information on that. Yeah.
Okay, great, thank you. I'll try and amalgamate a number of questions that were on a similar theme. They came from Aurora, James and Sarah. And please, any of you guys pop it up a hand or put something else in the chat if you wanted to get into some more specific information. But the questions seem to be around establishing trust with public contributors. And different ways of doing that, whether that's the approach that Bradford have taken or whether that is using a VCSC organisation and whether that maybe gives you sort of access to a really equitable number of community participants, or whether that can maybe be the same sort of voices and engagement. So building trust, knowing that you've got a fair and equitable range of community participants, and also maintaining engagement throughout that. So Shabana and Zahid, it would be great to hear your thoughts on that.
Thank you. So I'll just start with Sarah's question in terms of the idea of introducing the public contributor model within the local authority, and also the benefits that they found working with VCS organisations. I completely agree. They both have their sort of advantages, and one doesn't replace the other. So I think it's really useful to have both of those models at our disposal. And I guess the advantage of the public contributor model is it's almost easier for strategy teams and smaller teams with fewer resources to engage with a couple of people rather than sort of commissioning out a larger resource and time to VCS organisations. So it's almost one way of doing certain pieces of work. And what's nice about the public contributor roles is that they're embedded throughout. They're almost part of that management team and that working group. So they're involved throughout that whole process of a piece of work, which is a bit more effective than just consulting a few times with a VCS organisation. But for us, the public contributors have had that dual role. They've been our community links, and they've enabled us to get to and access community groups that we probably wouldn't have been able to. They've been sort of, the conduit between us linking with communities that are, seldom heard from or underrepresented. So I think without our public contributors for the piece of work that we did in terms of defining our community areas of research interest, our public contributors were instrumental in identifying the groups that we should be speaking with, but also co-facilitating the sessions with community groups with us to make them more effective and make them more trustworthy. I mean, as I said, we could say what we kind of wanted to do because they were in that role. So they were the halfway house between us as a local authority and a community group, and they helped that trust building because the communities trusted their public contributors because they were from within communities. So I think it's proved a really useful avenue for us and a really useful approach for us. And again, when I sort of talk about any sort of public involvement, working with public contributors or VCS organisations, I always like to frame it as an opportunity. So what is the community group? How is the community group benefiting? How are the public contributors benefiting? So we're constantly mindful of, giving them extra resources, agency, obviously paying for their time, backfilling development workers' times, paying for venues, making sure that our public contributors are trained up before sessions, giving them planning time. So by the end of that process, they've also got some learning out of it. They've got some qualifications under their belt, perhaps, if that's what they want. So kind of giving the power back to the community. So they've actually benefited from the process of the research and not just the outcome of it. Just hand over to Shauna. Or Zahid, do you want to come in now, Zahid?
Yeah, I would say like not I would say scanning the local area first, trying to know what groups, what diversity have got in that area. It's like a mix in both. Sometimes you might have a particular group from the BCSC organization, but you might have some community or members or a group of people who are not engaging. Those might not be as a group or they're least engaged with the research. You can approach them, then you can mix together, like for example, you have got a particular group from the BCSC, a small group I'm talking about, and then you have got a particular who are not group, but as a member, you can get them, onboard them, and at least you can go from that way. They will engage more people as well there. No, it's just trying to balance in the diversity. Actually, sometimes we can't always get all the people that we need in the table. Then we need to look for the people who are there. We need to find out, because what happens is about the BCSC, you get some particular of the people who are in the BCSC, but there are people who are not engaged or who are far away from there. That it's just about mixing them and balancing the diversity. I would say, that gives a better idea actually what the local needs are. Thank you.
I might just reflect really briefly as well. I think because there's a comment just come in the chat around making sure that we are inclusive and we're not just, it's a catch-22 really, because for co-production you want to develop relationships and start to understand someone else's point of view, and yet of course as you develop relationships you become comfortable with someone. So I think when you're involved in that, it's really important to be self-reflective and be open to learning, to undertake your own training in terms of understanding your own bias and being courageous to link out to new people. And it's almost like you have to hold both those things. You need to build relationships, but also be aware of what you don't know. And I guess what Zahid was saying there is, it's hopefully you can link in with people who've got that breadth of understanding and have a culture where you can have challenging conversations as well.
Thank you. I'll read out a question from Al, and Al, please feel free to pop your hand up if you want to give this a little bit of context to go with it. But the question is, how do you manage lived experience people's expectations?
I'll say something briefly, just I'm keen to. So I think Shan talked about at the beginning about how you might really be clear about expectations. So we actually have a document that we create, like terms of engagement, where we talk about what we can do and what we're offering and what we're asking, and we make it explicit. And even by writing that, it makes us reflect on what we can offer and what we can't. So I think having that and then going through it with one of your contributors that you're already working with to check that it makes sense, and having dedicated time to think about that. So we actually write it down, and then if we ask someone to become involved, we share that information with them and have a conversation. So that's one practical approach.
Yeah, similarly, we would make sort of clear from the onset what the requirements of the role are. We call it a role, not a job. We have an agreement that sets it all out that people sort of sign. If we're asking people to do anything that's kind of beyond their normal scope of work, we ensure that we've got induction for that piece of work. We give them extra time to prepare for it. And when we held our workshops, we had some extra facilitation sessions of co-creating the workshop with our public contributors, but also having a session where we gave some facilitation skills training to our public contributors, and then we actually tweak some of the sessions based on the feedback from them as well. And likewise, you almost do need some guidelines that you're working by. So we've adopted the Act Early co-production principles, and based on that we have so if you haven't heard of that, that's it's a Bradford specific document that I'm happy to share later, and it was devised by talking to community members. And we've then built our PPIE strategy based on those principles. And we have things in there, such as, meeting people in their sort of accessible spaces, making sure we are recognising people for their time and giving people the tools for the work that we're asking them to sort of contribute with. But, ensuring that, there's no sort of manager-employee relationship between a public contributor and the person that's coordinating the work. They're almost seen as, equal members of the team.
And I'll just say, like, there might be different expectation from different individuals, different groups. It's like ensuring before the session, like what the outcome would be, and always letting the people know what will happen, and just giving the clarity, like what will happen with the information that you are collecting actually. And because different group have got different expectation, who is in the research, who is not. Research is not about bringing the solution, it's about raising the voice, actually finding the solution, but it's not the implementation of the research group. It's ensuring that to the people, to the group before the session, like what will happen with the data, and letting them know. And this is the place, like the team who will be doing the research, they are there to hear from the group. Yeah. So yeah, just sharing the information and ensuring them actually what will happen with their data, but not promoting some things, I would say, because this is not what the team will do. It's just about finding the solution actually and raising the voice. Thank you.
Thanks, panel. I'll move on to another question. This one's from Robert. And actually there's, again, you'll probably see we're popping things into the chat all of the time. There's some resources we can share with you, Robert, as well, that I'll cut and paste into the chat also. But reading Robert's question out here, as co-production is a principle or approach, are there clear evaluation criteria for the success or efficacy of the co-production element, as opposed to just, did the final product work? I.e., was it really co-produced, and to what extent, and how do you evaluate that principle? Who'd like to take that one? Looking for a microphone to be switched off somewhere.
I mean, I can start. I think it's a relatively new area in terms of evaluating the impact of public contributors. We have lots of evaluation frameworks, but they usually evaluate the project or the piece of work. So I think it's a fairly new area, but very important. So I think there are a couple of evaluation tools out there, which I'm sure the Research Support Service has held some webinars on. I think it's something like the PIRIT tool or some other tools. What I have found quite interesting is to ask some of the public contributors to keep reflection logs and use that as a bit of an evaluation in terms of what their experiences of the process were, and to kind of embed that into our wider evaluation. But I'd say it's an area that's under development, and we do, I guess, need to test a few models of what works for different people in terms of evaluating the actual impact of public contributors. But I'm not sure we've got a solution to that just yet. Happy for Sean and Anna or anyone else to chip in there.
I think I'd agree that, yeah, like you say, it's a pretty new area, and there are some frameworks that are starting to be used, but I don't think I guess one of the things about if you're co-producing, about it being genuinely co-produced, hopefully if you're adopting those principles, it should be. But yeah, I think it needs so the work needs to be done there.
Yeah, I agree. I felt quite de-skilled being asked that question, because I guess it's almost instinctive for me. You know, I feel like if we've got engagement that works for the people that we're working with, you know, we have a sort of shared mission statement that's fairly straightforward, talking about managing expectations. And then I kind of think if we have engagement and the relationship persists and we have challenging conversations, but that's all my internal process. And then I do tend to more evaluate as a whole what we've come up with. Christopher Gibbs has put really in the chat earlier, higher up, put a link to an ARC, NIHR ARC resource on measuring impact. So yeah, I would agree with other panel members. I don't have anything like really strong to say, but yeah, I guess measuring it against the principles of what you're doing is what I do at the moment.
Thank you. So we've got time, I think, for one final question. I mean, it is quite a big question, so I'm hoping we can keep answers fairly concise. But Paul asks, how important is it that public contributors are from the community they are involved with? Anybody want to come in on that one, Shabana?
Zahid, I mean, I guess for me, it's fairly important they should know the community, because I guess they're almost in that advocacy role, speaking about communities. So when we selected our public contributors, we were working across 5 different constituencies in Bradford, and we selected public contributors who either lived or worked in each of those constituencies because they had that grassroots knowledge. We also worked with our ward officers and neighbourhoods teams to ensure that we were hearing from groups that don't normally get involved in research, and making sure we had a cross representation of people across the district. So I guess it's fairly important, because that's really their role, isn't it, to be advocates of the community that they are from. Zahid, what would you say?
I would say sometimes they are not, might be community member who don't have that much connection or experience. Sometimes you might have to open the gate, you know, to you might have to develop some particular individuals so that they can open up the connection, especially those who are not engaging. So it's not always you get people with experience or with the connection with the community, but sometimes you might support some particular individuals to bring that connection to you.
Fantastic. Well, we're on time now. Clock's just struck midday, so bring things to a close. And I just want to thank our panel so much for the discussion, all of the Q&A, for sharing your expertise today. And thanks everybody for attending and making this such a fantastic webinar. It's always so interesting to hear the conversation and the points of view at the end of it. So thank you very much, everybody, for attending, and we hope to see you at the next webinar. Goodbye.